Christmas Day in public health care facilities this year as compared to last year. The National Health Department says a total of 1,668 babies were safely delivered on Christmas Day as compared to the 1,360 babies that were delivered the very same time last year. Gauteng recorded the highest number of newborns at 428, with the least being, of course, the Northwest with 43 babies. The Chris Hani Baragwanath Hospital had the highest deliveries, followed by Tembisa Hospital, both of which are here in Gauteng. A National Health Department of Health says that the number of teenage mothers increased from 90 in 2024 to 130 this year. Well, joining us to further unpack this is National Health Department spokesperson, Mr. Foster Mohale. Season's greetings, Mr. Mohale. So Christmas Day always shines the spotlight, right, on teenage mothers. But I think you and I, as well as the rest of the public, can safely agree that even during any period or time of the year, this is a persistent crisis with now alarming rates that now include even young girls of 10 to 14 years of age. So what is the department's response to this on a national level, as of course the latest figures indicate a growing number each year? Foster? Foster, are you there? All right, he seems to be frozen for a moment. I just tested with him a couple of seconds ago. We're going to try and reestablish that connection link with Foster. Oh, okay, I do understand that he is back with us. So Foster, once again, so I was just asking you, I mean, we keep hearing, of course, that the numbers of the children, of course, that are becoming young mothers keeps growing year on and year on. And I think you and I can safely agree that even during any time or period of the year, this is a persistent crisis with now alarming rates that include even younger girls of 10 to 14 years of age. So what is the overall department's response to this on a national level, as of course the latest figures are indicating a growing number as well?
Yeah, good afternoon to you, Sis Alicia, and good afternoon to your viewers at home, and Merry Christmas, even though we are 2 days post the Christmas. Yes, look, firstly, also let's congratulate all the mothers and the parents who have welcomed the bundles of joy on Christmas Day, but also we are equally concerned about the rising stats of teenage mothers that we have recorded. Of course, correctly said that this is not only recorded on Christmas Day or New Year's Day. This is nothing special, but of course, we need to continuously raise awareness about this issue of teenage mothers, meaning that a lot of young people as young as the age of 15, 14, they fall pregnant. So this is our societal challenge. It is not the challenge of one department or one sector. We need all hands on deck in order to address the issue of teenage pregnancy, which leads to teenage mothers, in some cases also lead to unsafe and life-threatening abortion. So we need everybody to join us, the government, the civil society, the private sector, the NGOs, in order to address the issue of teenage mothers.
And Minister Chikunga, they're saying that teenage pregnancy actually undermines South Africa's future. Let's talk about that, though, Foster. I mean, legally, what is the role of nurses, doctors, let's just say medical practitioners as a whole, right? When a young girl is actually admitted to give birth, are they supposed to raise the alarm to relevant law enforcement? Take us through their responsibilities as the clinic or hospital.
Unfortunately, the role of the healthcare workers, the nurses and the doctors and other healthcare workers, their role is to provide healthcare service to any healthcare user. But look, it's too late now to start questioning the young girls when they're about to deliver the baby. So we need to start in our communities. The challenge starts in our families. When we see that our young children, young girls, they date, they go out on dating without having a family planning education, we keep quiet. So it starts at the family level, at community level. So of course, our nurses, they've got the role to ensure that they provide healthcare service to anyone, regardless of age, regardless of gender, regardless of a sexual orientation or race or color. So what we need to do, we need the parents they need to call these young children to order when they go start dating, especially for those who cannot abstain. We say at least try to use contraceptives, different types of contraceptives. They are available free of charge in our health facilities. Of course, as the Department of Health, we work with sister departments like the Department of Social Development, the Department of Basic Education, NGOs like your Love Life, your Soul City, and other sectors in order to empower these young girls and boys with sexual and reproductive health services, which includes family planning, to say for those who strongly feel that they cannot abstain, at least they must come to our facilities. And the good thing is that as the Department of Health, we have created a dedicated spaces in our clinics to ensure that these young girls, when they come to our facilities to seek family planning services, they don't have to join the mass, they don't have to join the general public. They've got the dedicated spaces where they get assisted by young doctors and nurses so that they become open. They don't feel this judgmental attitude that they always complain about.
Foster, a very quick one. Look, now I'm not oblivious to the fact that in areas like our townships and rural areas or even villages, as you're referring to communities and families, right? Usually the family would have accepted financial assistance from the perpetrator in what is referred to as damages, of course, to the parents of the child. And now if they are known, of course, to the family. So this issue is far deeper than just surface level in that regard. But can a doctor still report this to the police if the pregnant child is a minor? Because one would then assume this is statutory rape.
No, definitely. They do. Our healthcare workers, they do. Also, in fact, they established to check whether the person who impregnated this young child, young girl, is it an elderly, is an adult person, so that they can be, whether it was consensual sex, whether this girl was raped or not. But also, in most cases, these young girls, they don't disclose the age and the name of their partners. Of course, we were happy when we heard that in some provinces like KZN, a number of them, they were very open, transparent to disclose the age of their partners. But of course, some of them find that someone who's way older than these young girls, that's supposed to be a rape straight, must be supposed to be rape. But we need the parents and these young mothers to cooperate with our healthcare workers so that they can assist them to open the case with police. So if they don't show any form of willingness to cooperate with our healthcare workers to open the case against these perpetrators, then it becomes a problem, because the nurses and the doctors on their own, they can't go and open the case on behalf of someone who is not willing to cooperate. Of course, some of them, the issue of sugar daddies who give them any other financial resources and other benefits. Please don't disclose my name. Of course, anyone who fall pregnant underage, especially if you are impregnated by someone who's older than you, that is straightforward, is a rape.
Absolutely. I mean, is there even data, Foster, from the department in terms of just how many of these cases they've actually referred to police and ultimately got successfully prosecuted? I mean, older men grooming and having sexual relations with minors should never, ever be condoned nor tolerated in any way, shape or form. Now, these men must know the consequences of their disgusting actions, because we also then have excuses or hear excuses like it's socio-economic factors that actually contribute to this ill behavior, as you've just made reference to the sugar daddy saga.
No, definitely. In fact, we need to send a strong message. The day we get one of these sugar daddies arrested for impregnating a young girl is the day other men, they will respect, they will run away when they see this young girl. So, of course, that needs all hands on deck, as I indicated, that we work together with other law enforcement agencies, the police, but also the NPA through what we call the Tutuzela centers, to say those who are victims of sexual harassment, they need to get assisted from Tutuzela centers, where different sectors they are represented: health, social development, the police, the basic education, and so forth, so that we assist them, we give them a psychosocial support, but also advise them to open the case, and we support them with the legal resources, so that at the end of the day, we ensure that those who take advantage of socio-economic status of these young girls, they end up being locked up in jail. So we need to send a strong message to those who see these young girls as young as their daughters as their partners. So the day we send some of this to jail and we publicize them, we come to SABC, please know that we have sent so number of men to jail. So maybe that will send a strong message to other men. Say, please, when you see these young girls, don't see a potential a wife or girlfriend.
I mean, it's absolutely disgusting, Foster. Thank you so much. That's where we're going to leave it, sir. That is Mr. Foster Mohale there, the National Department of Health spokesperson there on the persistent crisis of young girls and teenagers now being pregnant.